Now, the UK is the first country off the block to start the vaccination rollout program of the Pfizer vaccine. As we said earlier, Russia and China, of course, rolling out their vaccines, but not enough studies have been done to build confidence about those vaccines. Now, in the UK, however, there has been a slight bump in the road after two people reported allergic reactions to the Pfizer vaccine, and the Medicines and Healthcare Products Regulatory Agency has issued an advisory now saying that any person with a history of significant allergic reaction should not receive the Pfizer BioNtech vaccine. Well, to talk more about the Pfizer vaccine rollout and also when can we expect the Oxford vaccine to be given that nod in the UK, we're now joined by Dr Vikram Talaulikar, Associate Specialist, University College London Hospital, NHS Trust. Thank you so much for joining us, and someone who's also a volunteer of the Oxford vaccine study. First and foremost, tell us about this reaction that has been talked about, how two NHS workers had adverse reaction or an allergic reaction to the vaccine. Has that caused any sort of big worry, because now this advisory has been issued that people who are prone to allergic reactions should not get the vaccine?
First of all, thanks for having me on the show. Thanks to you and the team. Well, there hasn't been a lot of concern. Of course, it's important that the allergic reactions are monitored and we take steps right in time so that we can care for people who have allergy or allergic reaction to these vaccines. It's very common to see these allergic reactions because this vaccine hasn't been tested in the masses. So whenever you try a new medicine or a new vaccine, you would expect a proportion of individuals to demonstrate sensitivity. The allergic reactions were mainly breathlessness, feeling a bit of malaise, and a few anaphylaxis-like symptoms, but could be dealt with using the common allergy treatments. And we will see probably more people developing this because, again, it's a new vaccine, it's a medicine that's being tried for the first time. But nothing major to worry about, and I would say this wouldn't stop in any way the rollout of the vaccination program. We just need to keep monitoring and seeing how the vaccine pans out in the general population.
And what are the reports regarding the rollout? How has it been going? We do know that elderly and, the frontline workers have been getting the vaccinations. So how has it been going, and when are they expecting that the others who don't fall in this, top category will start getting it?
You're right. I mean, the priority is, of course, the vulnerable individuals. So you've got the above 80s, you've got the frontline healthcare staff who manage ITUs or the A&E accident emergencies. You've got people who are also caring for others in care homes or the care home residents. So these are people you can prevent avoidable deaths because of the virus. So they will, of course, get the priority. It's expected that over the next few weeks, we're going to get more and more people immunized. So the above 70s will be called next. Then the wider healthcare staff will be involved. And then you got above 60s, above 50s. So it kind of keeps coming down in terms of the age eligibility. But it's going to happen over the next few weeks. Millions of doses are expected to be administered every week that comes by. So fingers crossed, quite a busy schedule for the NHS over the next couple of months.
And what can you tell us regarding the Oxford vaccine? Because here in India, that's the vaccine that we are looking forward to. And currently, the Serum Institute of India has applied for that emergency authorization. They've applied in the UK as well. And there are some reports that say that once the UK gives the go-ahead, perhaps here in India too, they will give that go-ahead. And that's expected sometime around Christmas?
Yes, I mean, that's expected possibly in the coming week or two, because the MHRA has already received the paperwork from the Oxford AstraZeneca team. They will be looking at all the graphs now, all the immunity that has been produced, the half dose, the full dose, the two regimens that have been described. So they're going to look very carefully at the data. And it does look like it's a very safe and effective vaccine. Once we approve here in the UK, although I must say the Indian regulatory bodies will have their own look. They will be now searching through all the data in India, and hopefully both the approvals will go hand in hand simultaneously, if not within a difference of a couple of weeks. So if we start pre-Christmas, that will be great. But at the most, we might see that the vaccine rollout happens in January, February, and to the wider population in the first quarter of the next year.
Right. And Doctor, you were a volunteer actually for the Oxford trial. So that's very interesting. And given that, there's a lot of vaccine hesitancy in the West or in various countries, I think this whole year there's been a lot of talk about science, and there's been a lot of anti-science talk as well. So tell us about that vaccine hesitancy, and what would you like to say?
Well, the first thing I would say to anybody viewing this program, please go and have the vaccine if you get a call from your health system to have the vaccine. I know there has been a lot of talking about anti-vaccine talks, myths which are being, or false propaganda that's been circulating around. At the end of the day, you got to salute the scientists who have now figured out how to oppose this virus. Within 12 months of this disease being discovered, you now have a very safe and effective vaccine. So you've got to believe in science. We can defeat this pandemic only if 60 to 70% of all the people in the world get vaccinated. So for vaccine to work, you got to have a lot of people having this vaccine. And if false propaganda or what we call as infodemic, which is happening because of all these myths of the vaccine circulating, we won't see the real benefits of the vaccine. This vaccine is really safe, effective, and the further vaccines which are being rolled out will be rigorously studied, robustly studied before they come out for general public use. So you've got to believe in science. And I think if we all get vaccinated, if we all take the precautions until enough people get vaccinated, we'll see an end to this pandemic by the end of next year or the year after.
Right, Dr. Vikram, that's an important note to end on, the fact that if only if 60-70% of the entire population gets vaccinated, will it help all of us in ending this pandemic? Thank you so much for joining us here on NDTV.
My pleasure.